Good morning, good afternoon, and good evening. Today, the 321st day of our continuous Zoom session of International Forum for Promotion of Homeopathy. So, before starting the proceedings, let us have a silent prayer for 1 minute. Okay, now we can proceed. Today, the 18th day of July 2021, our chief guest is Dr.Bindu Pulparambil from India, who graduated from Government Homeopathic Medical College, Trivandrum, Kerala, India. First rank in the final BHMS and gold medal from University of Kerala 2000. Received also Prakash Memorial Gold Medal for being topper among 3 universities in Kerala in the year 2000. Finished post-graduation in Homeopathic Philosophy from Government Homeopathic Medical College, Trivandrum. Diplomate of International Academy of Classical Homeopathy, Greece, and hold postgraduate degree in Anthroposophic Medicines and Integrative Oncology from Switzerland 2017. Did palliative care training from MD Anderson Cancer Center, Texas, United States America 2019. Have presented papers in various international conferences in Europe and US and at national level conferences in India. Member subcommittee on cancer and homeopathy, Cancer Council, Central Council of Research in Homeopathy 2019. State access for cash for Ayush departments. So a lot of things to describe about Dr. Bindu Pulparambil. Now she's working as a resident medical officer at the government homeopathy hospital East Fort Trivandrum, Kerala. The topic is muscular dystrophy, scope and challenges in homeopathic palliative medicine. The importance is that in fact at the age of 16 or 17, Hahnemann wrote an article, The Wonderful Construction of Human Hand, where he described about the functions of human hand. That's very important. So it's a very important homeopathy also. So I invite Dr. Bindu Pulparambil to start our proceedings. The platform is yours. Please proceed, Doctor.
Thank you so much, sir. Once again, I thank the organizers for giving me this wonderful platform of interaction on the very broad audience. So I will take this opportunity to share with all of you the topic on muscular dystrophies, the scopes and challenges in homeopathic palliative medicine. So this is one topic which, as you know, the condition, it is a very, very difficult and different condition presenting in the different realms of life. Sometimes as children, they could have a difficulty in walking, and as teenagers, most of them end up in a wheelchair, and the lifespan could be less than 30 years, and being one of the most debilitating diseases. That is where muscular dystrophy needs to be addressed and discussed, especially on a homeopathic platform. So the question is, as we all know, basically, this is a genetic disorder. So sometimes it could be acquired from the parents, or sometimes it could be acquired during any point of the modification of or the process of evolution. So the basic question is it a problem at the level of genes, which has to be addressed, or which has to be the person or the individual has to spend the rest of their life adjusting or understanding that it is a problem which has no solution, or which could be relegated to the levels of genes without a solution? Or should it be the question which should be addressed on the level of evolution or progression regarding its predictability? So we all know from the current medical knowledge regarding this condition, the outcome is quite predictable in the current medical scenario. So that is why the understanding has given us the realization that the lifespan being only up till the middle ages, but even during the tenure of the life, it is to be spent either with the support of people, or it is going to be a debilitating condition. sometimes very compromised, living on a wheelchair. So the nature and evolution of the disease being predictable, again, the question is pointed out to the fact that whether the individual has to live with that. The third and most important point to be dwelled on is, can it be a modifiable thing? Or is the disease to be addressed in a modifiable parameter? So we have to take the thinking onto a next deeper level from the homeopathic purview. Homeopathic drugs have actions at a very deeper level. So this action of the homeopathic drugs and its efficacy, can it influence the genes? Can it modify the expression of the genes? Can it arrest the progression of the illness? Or can it modify the life quality of the affected individual? Or the question from the patient side, or even from the physician who is faced with such a case, is there any hope for cure? So now this is the question that each homeopath could have in his mind when such a patient comes to him. And the very underlying factor that could distress the physician could be the agony of the affected and the family. As the solution has to come from the physician's side, to what extent a physician can offer the help to allay the agony of the affected and the family. So it becomes a responsibility of the physician to find out a way to pacify the suffering. So that is where we have to think of a solution in a given scenario of a genetic condition, with an understanding that it has its limitation, and to how far a homeopathic possibility lies in modifying the condition. So we have to think of it from three perspectives. One is at the curative point of view, then from the palliative point of view, and from a research perspective. So this is a very, very thought-provoking aspect, since we know that the medicines our homeopathic medicines, based on the principle of similars, can modify a condition, but will it modify to that extent of curativity, or whether the offer to the patient can be on a palliative perspective, and the patient can be equipped to live the rest of the life with a better quality of life. And so now, coming to the disease per se, the individual could have walking problems till the age of 10, or sometimes could be relegated to a wheelchair, having a skeletal deformity from age 10 to 30 to middle age. And sometimes they will have a very limited use of arm. Sometimes they will face with the ventilation issues at night. And sometimes the ventilation issues could be 24 hours. And as we can see, the life expectancy could go only up till 30 years of age. And the current solutions always lie on a rehabilitatory aspect, managing the patient symptoms with medications, sometimes steroids, sometimes surgical management when the individual is having a deformity which has to be rectified only with surgical measures, or whether the patient can be equipped with assistive devices, or whether physiotherapy can have aid. So first we'll think of in the perspective of palliative care, because the situation could be that the patient was a patient who already has come to the homeopath could be faced or could have reached a level of incurability, or sometimes the limitations of the disease also lies in the point of incurability. So the next option is definitely palliative, to support the patient uh, as he is, and to enable the patient to have a better quality of life. So that is the solution which has to be offered if one realizes that he is having an incurable condition, he is having a terminal condition, or it is a chronic debilitating and deformity which he has to live with. So the solutions which could be offered is definitely the relief of the distressing symptoms. If he is having a weakness, how to support the weakness, how to strengthen the individual, and whether the patient is having a pain, then how to manage the pain. And the very fundamental solution of how to cope up with the condition and how to give the patient the supportive care which will enable him to live with the condition in a purposeful way and in a better quality of life, and how we can modify the overall survival time, as we know the disease has got a predictable outcome, and whether the life expectancy can be prolonged beyond the middle age. So a quick note on the who are the beneficiaries of palliative care. Definitely, it envisages not only the individual, but as is very well marked in this condition in muscular dystrophy, the whole family has also to be supported. The family and sometimes the near ones, or somebody who is supporting the individual. So it is not only the individual alone that should fit the physician's consideration, but should be extended to the individual, the near ones, and the family. And from when till when? It is right from the diagnosis, which could sometimes in a uh, very fortunate few at a very early stages of life, but sometimes in the unfortunate majority, sometimes the time would have reached until adolescence when the proper diagnosis is made, or from the point where the disease has progressed to a very unsuitable stage of probably treatment. And sometimes the patient has to be supported at the last stages nearing death. And definitely the support has to extend beyond death to the family in bereavement. So what homeopathy can offer in neuromuscular diseases? Definitely, in a condition like this, symptomatic relief has to be in the offing, relief of pain, the improvement of the quality of life, the general improvement in the well-being, or improvement in the general condition, limitation of the disability, and slowing the progression of the disease to a maximum possible extent, and creating a less dependency situation on the usage of steroids, and also addressing the intervening infections and trying to reduce it, to reduce the frequent hospitalizations which could evolve as the disease progresses, and also frequent falls could result in fractures and surgical procedures, and extending the overall survival period than is expected, and minimizing the functional limitation of the individual. So now let's take a look at the different types of muscular dystrophy and a quick understanding of muscular dystrophy. It is a group of inherited disorders, diseases, and which is characterized by the weakness and wasting away of the muscle tissues, and with or without the breakdown of nerve tissue. So it affects the muscle proteins and causing weakening of the muscles, and also resulting in the loss of strength of the muscles and eventual disability. So the well-known muscular dystrophies are Duchenne muscular dystrophy, which forms a major category of the muscular dystrophies, which is really limiting the quality and the life expectancy of the individual. The Becker muscular dystrophy, which has got a better prognosis, sometimes the symptoms are milder. So in all the type of muscular dystrophies, there'll be an eventual loss of strength of the muscles, there'll be increasing disability and a possible deformity. So each type differs depending on the muscles affected and also depending on the age of onset. So each type has a different age of onset, the different rate of progression, and some types are named for the affected muscles. So here we can see that the deficiency is due to dystrophin, which causes an abnormal cell membrane and which causes a disruption in the calcium inflow, which causes an activation of protease. And finally, there will be an impaired calcium homeostasis resulting in apoptosis and necrosis of the muscles. And we can see this is a typical picture of a muscular dystrophy where the individual will have the posture very typical of muscular dystrophies, which we can see having a shoulders and arms which are held backwards awkwardly when walking. There'll be weak muscles in the front of the leg causing a foot drop and tiptoe contractures. There'll be poor balance, awkward and clumsy during walking, and thin, weak tights, especially the thighs, especially the front part. So, and the belly will stick out due to weak belly muscles. And you can see that the butt muscles will be weak. Then the knees may bend back to adjust the weight. So this is the typical picture. Sometimes there'll be contractures of the heel, tight heel cords, and the child sometimes will walk on tiptoes. So in Duchenne, normally it starts expressing from 2 to 6 years. Symptoms include general muscle weakness and wasting, affects the pelvis, upper arm and upper leg, and involving eventually all the voluntary muscles, and a survival beyond 20 years is very rare. It is seen in boys only. And sometimes, very rarely, it can affect women who have a much milder symptoms and a better prognosis. So in DMDs, Duchenne muscular dystrophies, the diagnosis is made by the gait, by the Gower sign, cardiomyopathy, elevated CPK, and DNA mutation analysis, delayed speech and language development, and cognitive impairment associated with it. In Becker's muscular dystrophy, it normally expresses during adolescence much later than Duchenne. Adolescence to early adulthood, symptoms are almost identical but less severe and less speedy progression. Survival extends up to middle ages, and disease is almost always limited to males. In congenital myopathy, you can see that it expresses, it is seen during birth itself, and symptoms include general muscle weakness and possible joint deformities. Progression of the disease is slow and has a shortened lifespan. There is another type, Emery-Dreifuss, present from childhood, and it expresses until the early teens. Sometimes the symptoms include weakness and wasting of shoulder, upper arm, shin muscles. And the deformities of the joints are common. The disease is slowly progressing, and the sudden death could occur from cardiac problems. In facioscapulohumeral dystrophy, it is seen from childhood to early adults, and symptoms include facial muscle weakness and the weakness with the wasting of shoulders and upper arms, and progression is slow with periods of rapid deterioration, and lifespan may be many decades after the onset. In limb girdle dystrophy, it expresses from late childhood to middle ages, and symptoms include weakness and wasting, affecting from the name itself, the shoulder girdle and the pelvic girdle is affected first. The slow progression is present, and the death is usually due to cardiopulmonary complications, which normally is the cause of the death in muscular dystrophy cases. So this is a pictorial representation where the affected muscles in different dystrophies are marked. So yeah, the 5 general stages in DMDs are normally the diagnosis could be made from infancy, childhood, and from the diagnosis made during the infancy, then the child passes on to the childhood phase, which is an early ambulatory phase, the late childhood and adolescent period being late ambulatory, and sometimes in the adolescent and younger adult, it is an early non-ambulatory, and in the adult life, total loss of strength of the muscles. So now let us take a quick look at how we can approach with the homeopathic perspective. So what could aid in selecting the remedy could be the symptom totality. If there is any specific symptoms which could point out to a rare, uncommon, peculiar characteristics of the individual, the site of affection of the particular or the muscles which are involved, the modalities which could be presented by the individual. The constitutional makeup is very important in muscular dystrophy cases in selection of the remedy. The temperament of the individual, the stage of disease which is presented upon, and the prognostic value, how quick the disease is going to be evolved to the next stage. So the severity of the symptoms and associated other conditions, if any, with the symptom picture. So in the repertory, we can have the rubrics, emaciation, which with the other sub-rubrics of whether it is the emaciation, diseased limb, emaciation from malnutrition, emaciation of the paralyzed limb, or of the feet or sole of the fingers, then extremities, emaciation, fingers, different, and the different hip, gluteal muscles, leg, calves, lower limbs, forearms. And also sometimes the patient could present with twitching. So extremities twitching, of the paralyzed parts, extremities weakness associated with paralysis, generalities, emaciation of the affected parts. So these are the rubrics which could help in selection, which are the symptoms of the disease, and the individualistic symptoms are more important, which has to be covered. So now I would like to share with you a few cases of the muscular dystrophy, the different types of muscular dystrophies, and how the homeopathic medicine has affected the quality of life. That is the main focus which we have to discuss today. So the first case, those are siblings. The first case, they have a family history where the mother's brother was affected with DMD, and the younger and maternal uncle died at when he was 27 due to respiratory paralysis. So the elder male child is 3 years, and this is a case which was presented with difficulty in standing up from sitting, was unable to lift the head after an acute illness when he was 2 years. And the younger brother also has DMD. Both the children are diagnosed, they are confirmed cases of DMD, presented with delayed talking. And he came with all the positive diagnosis. Gover sign was positive, and also then his CPK was elevated. The genetic testing confirmed it. So very elevated muscular CPK along with the molecular genetic. As you can see, he shows the duplication of exon 3 to exon 20 in the dystrophin gene, which is a confirmatory. The CPK, as you can see, is very elevated, 6,675. The physical generals were considered. Desires and aversions, the mental generals were considered. On repertorization, calcarea carb came first. And so the calcarea carb 0 bar potency was 0 bar 3, started with 0 bar 3. And as you can see that it was given twice a day. And on the second month of follow-up, he started showing signs of improvement in stumbling and falling. The more frequent falls were reduced to only 2 or less than 2 a day. So that was the improvement, that was the first sign of improvement. And as you can see, after 7 months, this child was walking with almost normal step, less frequent fall, very playful, and could get up from the squatting position, which was very difficult during the first visits. And then in January, there was assessment was done at Sri Chitra. So they also confirmed an improvement, but he was continued on calcarea carb into the different potencies. And right now he is still in calcarea carb in 0 bar 21 potency. 20, from 20, it was raised to 21. This is the eldest. Now we can see that he is able to run from one corner of the room to the other end. So the second case, male, 1.5 years, frequent falls, has all the symptoms of DMD, unstable walking, can only walk with support. The reflexes are positive. CPK is more elevated than his elder brother, 8,668. And he also has speech impairment. So in his case, the diagnosis was done at a much earlier age than his elder brother because of strong family history of DMD with his maternal uncle tested positive and the elder brother. And so he was put on homeopathic treatment when the elder brother was brought along with him. And here again, we can see the confirmatory molecular genetic testing showing the duplication. And here again, the physical generals and his desires and his the other regional symptoms, along with the mental generals, were considered, repertorized. Again, in this case, even though the set of symptoms were different, again, calcarea came high. As we can see, even if it is again calcarea carb, it is the different set of symptoms. And here we can see that the potencies started from 0 bar 3, but in the elder brother, the potencies were raised more frequently. But here again, after the 6-month time, both the improvement started almost at the same time. And in his case also, the assessment was done together with the elder brother. And he has a very marked, he had a more considerable improvement. And so that is why the potency was not changed and is sticking still to 0 bar 9, even now. So this, now you can see both the children running around. So now these patients still come on a monthly follow-up, still to the OP, and they are still continuing the medications. And now as far as the family is concerned, the frequent, they are now not having any intervening infection, no frequent fall, no injury related to falls. And as you can see that their mobility and the process and the growth process is almost as equal to the our age related changes. So the next case again is another case of DMD. This is a male child, 3.5 years, with short stature, mobile swelling. There was a mobile swelling in both the legs. Again, came with a confirmed diagnosis, increased CPK. As you can see, the CPK was keeping on increasing, and they had to take a growth hormone challenge test and was put on growth hormones, but the family did not want to continue the hormone treatment after 9 months, as you can see, because of the very elevated liver enzymes. So the family decided, the parents decided to discontinue the child from hormonal medications, and that is how they came to our OP. Here again, the totality was considered. As in children, it is very normally only the observable symptoms, sometimes observable characters, sometimes the most peculiar points could be the desires and aversions, and sometimes the very prominent mental symptoms. So here, on repertorization, calcarea force came high, also correlated not only by repertorization, but also corroborated with his mental, physical pictures. And as you can see, he was started with calcarea force 200, then raised to calcarea force 1M, then calcarea force 0 bar potency 0 bar 3 was given when there was new swelling which developed, because the potency had the medicine had to be repeated frequently. And then when he was stabilized, he was again put on 200 potency. And here now we can see that the child, the lower extremities, they don't show much of a disability or a deformity, and he is able to really stand up well, support by himself, and he again shows no difficulty in walking, and he can easily get up from his squatting position. So that is what the family is now happy about. He can be mobile with less falls. He's stable regarding his mobility, and he's not showing any disability signs when getting up from squatting position as well. So the next is a case of congenital myopathy, male child of 5.5 years, frequent falls, unsteady gait, difficulty to walk and raise himself from squatting position, difficult to climb steps, unable to kneel down. So here, the milestones were not normal, used to crawl but unable to sit or walk. And the concern of the family started when he had begun frequent falls from the age of 2. And they put him on Ayurvedic treatment. And then he was referred by another homeopath. So on case taking, the total picture was taken, and again calcarea force came up as the remedy. And first, because he was not in a very stable physical health, then the doses had to be repeated. 4 doses had to be given a day, calcarea force 0 bar 3. Then after the next review, the first symptom that was noticed was an improvement in the appetite and the bowel movements. So, and then in 2 weeks' time, the weakness started to get better. And now the review after 3 months showed that the patient is very able to be active. Even after school, the weakness was profoundly improved, able to stand up and walk on his own. So the patient had a confidence, and the strength of the muscles enabled him to stand up and walk on his own. And before, he used to walk backwards and climb. Now he's descending the stairs on his own. So that is the improvement which was noticed. He used to complain of leg pains, which started after half hour of travel. But now even the patient comes from Idiki, but even the patient now does not complain of leg pain even after 7 hours of travels. There is a marked reduction in the frequency of falling. The patient generally has a very profound improvement, more pleasant, happy, more involved in games, and the level of immunity to respiratory infections improved drastically. That is why, because of the frequent respiratory illnesses, he was put on Calcarea for 0/3 4 times. So that improvement was noticed in all the levels, from the point of his disability, from the point of his immunity, from the point of his mental, emotional well-being as well. So the patient potency was raised from 0/3 to subsequently 6, 9, and 12, and later on at the beginning of previous year to 0/15. And the improvement you can see in the subsequent videos. In last year, September, the child needed to support, had to hold but this is the most previous video. The child is able to walk, climb quickly up the stairs without support. This is the child happily playing in the water. The next is a case of limb girdle muscular dystrophy. Child is 6 years. As you can see, since it has affected the limb girdle, the difficulty is presented as difficulty in getting up from squatting position. That was the symptoms which were first noticed: difficulty in squatting, difficulty in raising from squatting, and difficulty in climbing the steps. Again, the confirmation was made from Sri Chitra Chitra Tirunal Institute, and the CPK on first confirmation was 1,700, which was subsequently elevated. But even during our treatment also, we could see that the CPK still kept on increasing, in spite of the fact that the patients showed symptom improvement. Again, the totality was taken into consideration. And for the acute, it started by prescribing Rustox, then Gelsemium was given, but later it was changed to Silesia. When the patient presented with cough, then the patient had an eczema, which was the eruption which developed, and Pulsatilla was given. Later, this patient always showed different symptomatology. So the prescription was based on the difference in the presentations. And finally, after Calcarea phosphorus, later on was given Silesia, and which is the remedy which is still continued. So as you can see, the child has grown up. In the next video, you can see. Is now able to run quite comfortably on a even ground, but as you can see, still requires a support on climbing the stairs. So on sharing these cases, as we can see, the two main points of discussion is we can possibly uh, have an influence on the outcome of the symptom, on the progression of the symptom, and outcome on the prognosis of the condition. So effective symptom control and the rapid progression can be curtailed when the homeopathic prescription is based on the totality, when an individualistic aspect of the patient is considered. And as you can see, when the mobility is improved, when the disability is improved, the quality of life improvement is noticed. And the very economical aid that we can offer is because of the long-term treatment, the cost effectivity in a homeopathic management is what we can offer to the family. So now discussing on the scope of the homeopathic management in such a condition is we can modify the symptom at a functional level. We can improve the disability factor, thereby directly improving the quality of life. We can intervene in the fate and the outcome of the condition. And there's a big scope lying for research at the level of expression of genes to how far the gene expressions are modified and whether the improvement at the functional level can have a corroborative improvement or an manifestation at the change at the genetic expression.
Okay.
But the challenges that we have to still face is that in such conditions, an interdisciplinary approach is definitely required, because in the last case, the patient, when the patient had come to us, was already on Ayurvedic treatment. So it was continued, and the patient is still, is having both actually the doctors, the Ayurvedic doctor, and from our side, we both do it at a very in a very positive and in a very conclusive way, because with the understanding that it is an incurable condition, the patient is given the option of selecting the best of all the treatment modalities which he can taken. So it requires an interdisciplinary approach, sometimes rehabilitatory measures, sometimes physiotherapy, and sometimes the best could be offered only when different treatment measures are converged. The disease progression and inevitable death can be prevented if the right intervention is opted. So the possibility of having the best measures should be given to the patient by doing it in the right way. And but the main challenge is the limitation as to how the possibilities or the positive impact of homeopathy can be utilized by the individual or by the family. That awareness is yet to reach out to the masses.
Yes, doctor.
So in conclusion, I would like to say that even in conditions like muscular dystrophy, even in conditions where the curability quotient is very limited, the individualized homeopathic approach can modify the quality of life in debilitating and disabling diseases. And homeopathy can offer a distinct option in modifying the progression of the disease.
Okay.
So with that concluding note, I would like to wind up, and I would like to thank you for the for listening to the topic, and now I will take the questions.
Yes, yes, okay. Congratulations for very nice presentations. The first question was can it be modified? Yes, you did prove that it is modifiable through your application homeopathy. It's a very important aspect you have shown. There was a time for question and answer session. There are a lot of people are waiting for their answers. So
Hello, we want to see your face, doctor, first.
Oh, okay. I had put off the video because I'm posted in COVID duty, so I came back.
Okay.
In fact, inside the car.
Great achievement. But we can see that these are all calcium-related medicines and silicea from earth and calcium carbonate. And this we know that this having some similarities, that medicines you have selected having some quality. But what I want to say that, what I want to ask is, what is the differences or the changes happening inside the body? Have you ever studied it?
Yes,
Inside the
that
body
is-
changes.
Yes, that is the third point which I had highlighted. From a very research perspective, that question has to be fundamentally studied as to how the gene expression is modified with the application of our medicine. As we can see that there is a definite improvement in the functional status of the individual, there could be some corroborative change which is modifying or which is affecting the protein or which is giving the strength to the muscle, but that has to be confirmed with a muscle biopsy, that has to be confirmed with genetic testing, which is a big
yes,
area of research.
everybody knows that. That is not an important thing, I think. Everybody knows that. Next, please, Dr. Amir Malik, please. Please ask him brief. Dr. Amir Malik?
Yeah. Oh, may I talk? Oh, I'm sorry. First of all, I'm sorry. May I start, sir?
Yes, of course.
Oh, thank you very much. First of all, Honorable Dr. Bindu. Binduji, it's a very great presentation, and your approach is very classical. And today, because whenever I see the topic of that, our muscular dystrophy, this is a very biggest example I want to quote today. And that is that documentary I had been seen in 2004 on Discovery, Doctors Hospital, Washington, D.C. in USA. They expose a muscular dystrophy case, that how accidentally they approach our an excellent medicine, Apis mellifica. I would like to give that decode the whole details and story of the patient. That patient, she is suffering from muscular dystrophy. In 2004, she went to Doctor's Hospital, Washington, D.C. in USA, and doctor said, we cannot treat you, you are over, may you go for the mercy death. This is what the words doctor had been told to that woman, and she said, I cannot go for this. She cannot even eat herself. She cannot swallow the food, anything. She is on the liquid diet. When she get back her home with her maid, she went in the garden, and accidentally few honeybees sting that woman. And the very next day, she feels, after the sting of that honeybee, that the circulation and the temperature on the one side of the body is changed. It's get better. So for 6 months, she told her maid, please bring the honey bees and sting my body. And after 6 months, by the honeybee venom, what happened to her body? The circulation starts, the dystrophy starting disappear. Yes, Honorable Madam, I have seen you are so much conscious about the CPK, creatine and phosphokinase. I would also like to hear, just give a detail that leadum, a tea, a kind of tea. It's very important for CPK. It's rapidly downfall the CPK.
Doctor,
And
please, doctor, time is limited. Please ask your question.
yeah,
Time
and
is limited. That's why.
yes, sir.
Time limit is there, doctor. Please ask your question. You have it.
Yeah, and I will just wrap the details that after 6 months, they launched the B venom for the muscular dystrophy patients, for the arthritis patients, and for the blood sugar and hypertension patients. And at that time, I just want to declare and tell the pupils and the patients, please see our medicine Apis mellifica have this ability to cure the muscular dystrophy. Honorable Madam Dr. Bindu, please may you add this medicine on the first if when you are treating the muscular dystrophy. It's my request, and I would like to know this. And for the CPK, I would like to tell the medicine Lidum. And to improve the creatinine and EMG, we have to go for the lithium carb in the case of muscular dystrophy. And whenever, as you have mentioned, the patient, I think so ginseng and gelsimum, we should not forget these also two very important medicines to restore that kind of dystrophy. Because in my clinic, I have also treated the muscular dystrophy patients with help of these kind of medicines. Number one, I have put the Apis mellifica. Number two, I put the lithium carb. Lithium carb is the one of our biggest medicine which improves the EMG in the muscles. It's have incredible capacity and ability to enhance the muscular activity and the nervous system, the interconnection of nervous system
Okay,
and
okay,
the
doctor, please. Dr. Federico, please, sir.
Thank you very much for inviting me. Whether it is audible?
Yes, sir. Yes, sir.
Yes. Thank you very much, Dr. Bindu. It was very exciting. It was very nice. So I was treated about 15 cases, but only 3 or 4 cases only it was improved. So it was a difficult thing that the sticking up onto the treatment. So what I felt, I gave that the plumbum, causticum, calcarea, and tuja, etc. These are the other medicines also. It is very good that your calcarea is also, I tried calcarea was carnivores, etc. also in 6x I was giving. So it was improved. So it was an excellent presentation. Thank you very much. Keep it up. So because the other people also want to talk, so I am not going to so much detail. Okay, thank you very much.
Yes, sir. Thank you, sir. Thank you, sir. Next up, Pareed Bagan, sir, please.
Dr. Bindu, good evening.
Sir.
You have made an excellent presentation, especially from the point of view of practical aspects and also for academic interests. You have concluded with the optimal notes. That is also very happy thing. I would like to know that the spinal muscular atrophy is also coming under this muscular dystrophy. It costs about the cost of the medicine is also very high. It's 18 crores and something like that. Is it coming under this category of medicine? Another thing is there is a lot of scope for research in homeopathy under this particular category. That's all what I want to know. Awareness, we have to create awareness among the people about the scope of homeopathy to treat this type of medicine, because it is very cost effective, as you pointed out. Please. Thank you.
Yes, sir. Yes, sir. What I put my faith on is that as long as we can have symptoms to guide us, the diagnosis is just a matter of getting a diagnosis for prognostic purposes. But we can manage, we can take the symptoms and find a suitable remedy which can modify, which is what I feel as I work in the palliative field. And the second question, definitely the highlight point is the cost effectiveness. If a medicine can modify, any medicine in the materia medica, I believe, can act provided it matches the symptom of the individual. More the individualistic symptoms, the better. And the cost effectiveness comes along with a good remedy, the selection of a good remedy, And the third point, which sir, you have taken up, is about the awareness. I would really appreciate highlighting that point, because only by spreading, only by having an awareness of not only among ourselves, but in an interdisciplinary purview, when other doctors can also send their patients to homeopathic physicians, the patient can get the maximum out of that. So in our cases, in the selection of our cases, the two cases are referred by a doctor from Ayurveda who is currently also seeing the patient, and the another case is referred by a homeopath of our department, Dr. Blessy. So this is the awareness quotient which I have to really recognize. And definitely the awareness among the homeopaths and the other doctors from the other disciplines can later on extend to the general public, creating really bringing the patients to the right doorsteps.
Okay.
Thank you very much. All the best. Thank you.
Thank you, sir. Nice questions. Madam Beatrice, yes, sir, please wait. I shall come to you back to later, because you have to say the auto signs also. Please wait. Please bear with us. Dr. Logamani Gupta, please.
Hello.
Yes, yes. Hurry up.
Thank you.
Yeah.
Thanks a lot for such a nice session. I want to ask two questions directly from ma'am. My real nephew is suffering with multiple congenital abnormalities like cerebral palsy, muscular dystrophy, dyslexia, and very, very, very slow to learn. So initially for 4 to 5 years, I gave him these all biochemic tissue medicines like Calcarea Fos, Silesia, Calcarea Flor 2. And in homeopathy, we give Thuza and Apis. Ma'am, can you please guide what is the fate or prognosis of this child? He is 18 years old now and multiple congenital abnormalities. We had shown him in Gangaram, all the tests and investigations are normal.
Okay.
Genes studies are normal. So please guide, what can we do for him?
In such cases, I think when such a condition, such a rare condition comes up with a different, like a syndrome or different conditions coming together, I think homeopathy can definitely modify the progression or the course of progression of the condition. So the first important and the first main thing that the patient will feel in an improvement level could be definitely addressing the most distressing symptoms, which can be really addressed with a homeopathic prescription. So whatever be the outcome, whatever is the predicted outcome of the condition can be modified. So it is when multiple congenital issues come up in the same patient that I think homeopathy takes the prescription to a very higher level, that the totality of all the symptoms of all the syndromes or all the conditions plus the individual symptoms taken together can point to a remedy which covers the individual in a very definite way.
Okay, doctor.
Ma'am, just a minute, sir. Just a minute.
Conclude, doctor. You are going please bear with us. Dr.
The contact number, please.
Mahmoud, doctor. Can you hear me? Dr. Mahmoud?
Yes. Yes. Do you hear me?
Yeah.
Yeah. May I ask?
Yes, of course.
Yeah. The question is the exons, the exon gene expression. What is the expression of the gene effect manifested as on proteins or on neurons, cell body, myelin sheath? And accordingly, what is the treatment rubrics mode of action according to the expression of the genes? Did you understand me, doctor?
Yes, I understood. Yeah, definitely the condition manifests when there is an expression of the exon of a particular gene over a particular gene. So when our medicine affects positively on the individual, there could be a modification which has to be proved definitely, but only with a modification at the expression level could a symptom which normally has a very progressive outcome either could be stabilized or either could be regressed. So definitely that the modification could stand on the genetic expression itself.
May I ask another question? Yes.
Yes.
Can we categorize this disease with other myopathic diseases such as expression of multiple sclerosis, amyotrophic lateral sclerosis, on some that? Are they the same mode of action on the body?
Yes,
The
Dr.
mode of action could be different because we do have cases of multiple sclerosis and amyotrophic lateral sclerosis, and in one case of amyotrophic lateral sclerosis there was a definite improvement in the patient. The patient, when he was registered as a patient, was completely bedridden, intubated, could not swallow food, could not walk. But after causticum was given, causticum 0/3 was started on the patient. The second follow-up, the first visit after 2 weeks, it was a home visit patient. We could see that the patient was propped up on a wheelchair, which is a very definite improvement. No other medication was going in, and the patient was only on our medication. So the patient later improved to a more definite scales of improvement. So I think definitely there is a modification, but at a different level.
That's a great. Did you sorry? May I ask? Did you consider the oxidative stress on your treatment of the multiple sclerosis? Do you use the principle in treatment of those patients?
From the homeopathic angle, definitely the symptoms of the patient are the sure guidelines to selection of the remedy, but the other parameters will be definitely covered if the right remedy is there.
Dr. Ganesh, please, in 1 minute, please. Ganesh.
Oh, good evening. Very, very good presentation, Dr. Bindu ma'am. I really take this opportunity to congratulate you for this wonderful session, and thank you for your wonderful presentation.
Yes. Now, Dr. Beatrice, please say a lot of thanks and conclude. Thank you, ma'am.
Yes, thank you. Dr. Bindu John, I'm talking from Germany, and I'm very, very impressed about the very great cases and hope-giving cases. I'm impressed how you're treating these muscular dystrophies. Just a very short question to understand well the potency. If you say 0.3 twice a day.
LM3.
Very good. Thank you. I understood. I tried to understand this. So
yes.
Yes, I understand.
In India, we are more used to saying it 0/3, but which is equivalent to, which is actually LM3.
Okay, I'm happy to know this because I'm also working a lot with LM potencies. So the time is finished now, Dr. Manoj. Huh?
Yes.
We are finishing this time now.
Yes, please say a lot of thanks to Dr. Bindu.
Oh, that's a pleasure. Okay, Dr. Bindu, thank you very much for the great, great, great presentation, giving hope to us, giving light to homeopathy, giving joy to all the group. And it would have been great to have 1 more hour with you, putting all the questions. And Dr. Manoj did very well to combine everything everybody could ask in the right time. So I wish you health and hope and all the best.
Thank you so much. Thank you, madam. Thank you, Dr. Manush. Thank you, one and all. Thank you.
That was the end of this session. We'll go to the second part of Malayalam session. Those who are interested to continue in this session can continue, others can leave. Especially Dr. Beatrice, yesterday I was waiting for to hear the Malayalam. Thank you for madam that. Okay.
I try to hear your language. It's a nice language. I enjoy it. Okay. One day, if you like, I could speak in German with you. I could speak the first aphorism of our master Hahnemann in German, if you like.
Yes, of course. Please.
Okay, we will do that. Okay, bye-bye.
Bye.